Hey, my name's Dr. Gary. What's yours?
Marcus.
Nice to meet you, Marcus.
Nice to meet you.
Today I'm going to be evaluating your spine, about from your upper neck to your belt line. That's okay. I might need to expose some areas in that region, if that's okay with you as well. I guess you please go over there and remove your shirt for me.
Sure.
Thank you. Thank you, Marcus. If you please sit down and face that wall for me. Sure. Go ahead and do a full evaluation of the spine from his upper cervicals down to his SI joints. And the seated position, of course. I'm going to go ahead and palpate you now. That's okay?
Mm-hmm.
His SI joints have healthy movement. They appear to be normal functioning joints. I feel a little restriction in the lower thoracic area. I'm going to go ahead and evaluate that area again. Please, could you please put your arm behind your back? Thank you. Bisecting the bottom of the scapula all the way to T7. Using a broad contact, I'm going to go ahead and flex them forward to see which joint is restricted. Could you please cross your arms over your chest? I'll go ahead and flex them forward. And extend them back. Okay. There was limited movement in this joint right here. I don't know which one that is. If you please, Mark, could you please put your arm behind your back again? Thank you. It's joint between T8 and T9. Now I'm going to go ahead and check rotation on T8, T9. Okay. Rotation appears to be restricted when I rotate to the left. Now I'm going to go ahead and do lateral bending. And it's restricting the lateral bending to the right. So now the restriction in this joint that I found should be a PLI for, is posterior, and I couldn't rotate to the left, so it's L. As well, I couldn't lateral bend to the right, making it I. So it's stuck in a posterior lateral inferior complex. Now to finish evaluating this area, I need to do the ribs associated with it. Please cross your arms for me. Give me arms again. Thank you. Thank you. Just go ahead and cross your arms for me again. Thank you. After evaluation of his ribs, they appeared to be normal movement. For elevation and depression, I went to the T9 rib for elevation, rotated Marcus toward me, laterally bent him, and flexed him. And I went to the inferior aspect of the rib to check his motion. For depression as well, I laterally bent Marcus toward me, rotated him toward me, rotated away from me, and extended him. And I put my contact point on the superior aspect of the rib. I'm going to complete the evaluation by going over his cervicals. Marcus, could you please relax your head? Okay, Marcus, could you please rotate your head to the left and to the right? To the left again. To the right. His C1 occiput seems to be a little stiff. I'm going to go ahead and evaluate it. Okay, so after evaluating his C1 occiput joint, I found that it was limited it had restriction in flexion, right rotation, and right lateral bending, which would make it RS. I'm going to go ahead and have Marcus, will you please sit up straight and close your eyes and flex and extend your head over and over until I say stop. And you think you're facing the wall straight. Okay, go ahead and stop. As you can see, his nose line drive is cocked up a little bit, so that would make it superior as well. Now, Marcus came in complaining of right hip pain. I did not find any restriction originally in his SI joint, but I'm going to go ahead and evaluate that anyway now. Okay, Marcus, could you please leg prone to the table for me, or face down? Sure. Let's go ahead and relax, okay? To check restriction of his right SI joint, I'm going to go ahead and do flexion extension of it. After finishing evaluating his right SI joint, I believe it was restricted in flexion. I did not feel the iliac crest smoothly glide past the sacrum, but during extension I could feel the sacrum smoothly glide past the ilium. And that will conclude the end of this examination.